So what are you seeing as successful ways of people that are able to treat cancer? Like, what are some of the I guess, what's some of the data that you're seeing as being someone that is actually, spending a lot of your time actually treating these turbo cancers, and what results are you seeing, and what can you recommend based on that information?
I can tell you that mainstream oncologists will not look at your vaccine status. They may not even ask for it. They will certainly not consider it in any of their treatment plans. So whether you're unvaccinated or whether you've had 10 COVID vaccines and booster shots, if you get cancer, they're treating you the same way. And I think this is a big problem because the cancers in people who have been vaccinated are much more aggressive. You have less time. You don't have the luxury of time, which is what sometimes oncologists rely on. If you have even a young person who's comes in with a stage 1 breast cancer, well, no one's going to rush. The oncologists are not going to rush. Maybe you wait a few months before you get your surgery. Maybe you have to wait 4, 5, 6 months until you have your lumpectomy. No one's rushing in these situations when maybe they should be. And so the oncologists are not recognizing the fact that the cancers in the vaccinated are much more aggressive. So it's that much more important for people to take matters into their own hands. They can work with the oncologist, but do additional things to really give yourself a much better chance at a better outcome. And so what I'm seeing is for the past year and a half, I've been working with antiparasitics that are being repurposed for cancer. This is ivermectin, mebendazole, and fenbendazole. And the reason is because there's a big body of research. There are over 400 published papers on ivermectin in cancer. There are over 240 published papers on mebendazole in cancer. In fact, Johns Hopkins quietly secured a patent in 2021 on mebendazole for treatment in cancer, specifically the most aggressive cancer, which is glioblastoma, brain cancer, extremely aggressive cancer. Johns Hopkins has the patent. They are also running quietly several clinical trials with mebendazole in cancer. There's colon cancer, gastric cancer, and brain cancer, including children with brain cancers as well. So this is not fringe. This is not something that is far out. There's actually real science behind it, patents behind it. And when you search a lot of the AIs, for example, Perplexity AI, and you ask, what are the most promising repurposed drugs for terminally ill cancer patients today? It will give you in its search in the top 3, you will get ivermectin as number 1, mebendazole and fenbendazole. There's other antiparasitics like hydroxychloroquine will be in the top 10. You will have curcumin in the top 10. You will have EGCG, which is from a green tea extract, in the top 10. Resveratrol in the top 10. Metformin, which is a diabetes drug, but also has anti-cancer activity, in the top 10 as well. And what I have found working with these antiparasitics is that there is a benefit to patients in at least 75% of the cases. Now, most patients come to me very, very late. They come when they've exhausted all other options. They've put their body through multiple rounds of chemotherapy, radiation, immunotherapy. Everything has failed. The doctor has told them, we have nothing left to offer you. You have 3 to 6 months to live. And I get a lot of those situations. So patients come to me very, very late. I wish most patients would come to me early when it's stage 1 or stage 2, even stage 3. And some do. I do get breast cancer patients, for example, who have large tumors, but they're waiting. They cannot get surgery. So they're waiting. While they're waiting, they take ivermectin, mebendazole, and their tumor shrinks by half, or it shrinks by 2/3. So overall, about 75% of patients have some kind of a benefit. It's not always tumor shrinkage. Sometimes we can just stabilize the tumor. In brain cancers, for example, we can stabilize the tumor so it doesn't regrow after the surgeon has taken most of it out, or that the tumor doesn't come back. Brain cancers, the tumors have a propensity to come back very often. Skin cancers, they come back. Bladder cancers, they come back all the time. Every 3-4 months, when the patient has a cystoscopy, there's a new tumor there. These antiparasitics can stop those tumors from coming back, for example. Now, you can take these antiparasitics like ivermectin, mebendazole, fenbendazole. You can take them with any conventional cancer treatments. As Obamacare or as Obama told us, if you like your doctor, you can keep your doctor, right? So if you like your oncologist, you can keep your oncologist, and you can work with your oncologist, and you can take these antiparasitics with any chemo, with any radiation therapy, with any immunotherapy, hormone therapy, targeted therapy, you name it. You don't have to give anything up. It's not a either or, you don't have to say, well, now I can't do chemo or I can't do a clinical trial because I'm taking ivermectin. You can always do combination treatments. And I found over the past year and a half that the combination treatments tend to be the most powerful, and patients tend to have the most dramatic outcomes. Now, again, we're dealing with, for example, stage 4 pancreatic cancer or stage 4 ovarian cancer, which are in many cases death sentences. I've had many of those cancer patients go from stage 4 to cancer-free with combination treatments. Chemo, ivermectin, mebendazole, maybe some supplements like curcumin, AGCG, keto diet or low-carb diet, also very important to fix your diet so that you're not feeding the cancer with sugar. Throw in some prolonged fasting, like a 3-day or 5-day water fast. Reboot your body, clear some cancer cells, stimulate and regenerate your immune system so it fights the cancer better. And these combination treatments that I've been helping cancer patients with, we've seen some very, very dramatic results. Patients going from hospice to being cancer-free, patients going from having an appointment for euthanasia in Canada. We have medical assistance in dying or MAID. So some cancer patients, they get their appointment with their oncologist and they get an appointment for euthanasia. And I've had one patient who had that appointment and then a few months later became cancer-free.
Incredible. Yeah.